Dear colleagues, I'm Christoph Diener from the University of Duisburg-Essen in Germany, and today I am presenting 6 studies which were published in January and February 2022. Let me start with amyotrophic lateral sclerosis, ALS. There is a substance called Adiabaron, which was investigated in Japan in placebo-controlled trials, and in a subgroup of patients with ALS, there seemed to be a benefit of this substance. And Adiabaron was approved in the United States, in Japan, but not by EMA for Europe. Now, what do we know about this substance in everyday clinical practice? A group in Germany performed a real-world study with 116 patients who were treated with Adiabaron for 14 months, and another group which received standard of care. And these patients were propensity matched. Unfortunately, Adiabaron had no impact on the progression of the disease, of mortality, and the time to ventilation. And this means that most probably this substance is not effective in patients with ALS, also in subgroups of patients where there seemed to be a benefit in the study in Japan. The next study is in spinal cerebellar ataxia type 2. And this study was performed in 45 patients in France. The investigators tested riluzole, which is approved for ALS, compared to placebo. But unfortunately, there was no benefit of riluzole for primary and secondary endpoints, and this means we still have no effective therapy, medical therapy for this condition. My next 2 studies concern sleep. The standard sleeping medications are either benzodiazepines or substances that work via the GABA system. And now we have a totally new generation of sleeping medications or for the treatment of insomnia. And these are the so-called orexin receptor antagonists. Orexins are produced in the hypothalamus, and they play a very important role for the control of sleep. Now, there were 2 randomized placebo-controlled studies published in Lancet Neurology with daridorexant, and these studies had more than 900 patients each. And the 2 doses tested, 25 and 50 milligrams, were clearly superior to placebo for the induction of sleep, the quality of sleep, and there was no hangover for the next day. And this seems to be the most important benefit of this new class of substances, that they improve sleep without effective sleepiness or awareness during the day. Now, the trial duration was 3 months, and daridorexant was approved in the United States a few days ago. My next study deals with patients who have the opposite problem, idiopathic hyposomnia. And these patients have sleeping disorders, but also increased sleepiness during the day. And this study, in 154 patients published in Lancet Neurology, compared low sodium oxybate with placebo. And there was a significant benefit of oxybate in the Epworth Sleepiness Scale, and the drug was relatively well tolerated. Now, the fact that the drug has a low sodium content is important to prevent hypertension. My next study deals with MS, pregnancy, and immune modulatory treatment. This is a registry real-world study of 255 women who became pregnant in Germany. A study was published in JAMA Open. Now, these women terminated the therapy with natalizumab either before pregnancy or during pregnancy. And unfortunately, they experienced a higher rate of MS exacerbations. And about 10% of these women had an increase in permanent disability after pregnancy. Now, the possible consequence would be that this treatment should be continued during pregnancy or should be changed to another immunomodulatory treatment prior to pregnancy. In my last study, published in Lancet, deals with the treatment of COVID-19. You all know that COVID-19 leads to an increased risk of thromboembolic events both in the venous system and in the arterial system. And the recovery group investigated whether adding aspirin has a benefit. And they investigated 14,900 patients. Half of them received aspirin, the other half did not. And this had no impact on mortality and length of stay in the hospital. There were fewer thrombotic events on aspirin, but a slightly increased risk of bleeding. So most probably aspirin has no additional benefit. But one caveat is, remember that most of these patients received low molecular weight heparin and cortisone. Dear colleagues, 6 interesting studies from January and February 22, which might have an impact on how you treat your patients. I'm Christoph Diener from the Faculty of Medicine at the University of Duisburg-Essen. Thank you very much for listening and watching.